I'm Dr. Sue Decotiis. A lot of my patients ask me as they get older, can my hormones affect my weight? And the answer is absolutely yes. And what I'd like to talk to you about right now is estrogen. So we start producing a lot of estrogen as women, as little girls when we go through puberty. And it stays pretty high until about the age of 35. And at that point, it starts going down little by little until we hit menopause. And that can be anywhere from, let's say, 45 to 55. And at that point, estrogen goes down pretty dramatically. And a lot of women have very obvious symptoms from this. And this can be things like hot flashes, night sweats, mood changes, inability to sleep well, and of course, weight gain. And that is really not something that a lot of people like. But realize even 10 or 15 years before someone goes through menopause, estrogen can affect your weight, because the decline really affects your brain, your hypothalamus, and this is where we believe your metabolic thermostat is set, and that determines how many calories you're going to burn each day. And also the decline of estrogen can also increase cortisol levels, and this will increase the effect of your insulin not working well. So every time you eat a meal, the food is broken down into blood sugar. And blood sugar has to get into the cell to nourish it. And it's insulin's job to transfer that sugar from the food, the glucose, into the cell. And when it doesn't do this well, the cell is tired and hungry, and there's too much sugar sitting on the outside. And the body responds by increasing even more insulin, and that you have this yo-yo effect with insulin. And this can cause people to become very, very hungry. So you don't like that effect of cortisol being high. So it's very important to think about balancing hormones and getting those checked. People tend to be able to maintain a healthy weight and be able to maintain weight loss that they've tried so hard to succeed when their hormones are balanced. And estrogen is a very important one for women. And you know what? For men it is too, because many times as men get older, naturally their testosterone can get converted to estrogen. And this can make them have sometimes what they call the male boobs, excuse my expression. And they can also get much more belly fat, as can women when estrogen changes. So it's really important for us to realize, if we're looking to lose weight, that our hormones have to be balanced. It's extremely important. And hormones can be checked by a simple blood test. And we look at all the various types of estrogen. There are 3 types of estrogen. And for testosterone, we want to make sure that we're looking at not just the total testosterone, but the bioavailable testosterone, because that's really the type of testosterone that's working at the level of the tissues. For the most part, blood testing is the best way. And bioidentical hormone replacement for people over 40 or 50 can be very, very important to control weight, enhance their sense of well-being. It will help them optimize sexual function, which is very important. It will help them optimize their exercise function, so that they're going to burn more calories when they work out, and they're going to be able to build muscle. And as we know, for both sexes, having large amount of muscle mass is very, very important for being able to continue to burn calories and maintain your weight.